why we as healthcare providers plexus and share the opportunity with others. I am Dr. Rachel Davis. I am a very blessed and grateful Emerald Ambassador with Plexus. I do still practice pharmacy in my day job, and I do work in pharmacy benefit manager as a pharmacist in United Healthcare Optum RX. So thank you guys again for joining. I can't say that enough. As a healthcare provider, and just as a working mom of three very busy, lively kids, a wife, a sister, a friend, a soror, all the hats that I wear, and I'm sure many of you do too. We sometimes, or I was, figuring that it was because I was so stressed. I was anxious. That's why I was tired. I suffered lifelong with earaches, chronic sinuses, vaginal yeast infections, brain fog, just being really tired. And I managed because it was normal, right? I didn't have a disease state that, like, some of the patients that I help on a daily basis to manage a disease. So I just decided, I was just gonna make it do what it do, right? I was just going, that was gonna be normal. My friends are tired, and the ones that aren't, they're marathon runners, and those are those people. Well, in walks Plexus, guys, and I was introduced to Plexus products before, like 3 years ago, because I had a very good friend. She had good energy. She was one of those people. She had good energy. She ran. She had good skin. She was thin. And she said, "Oh, well, I found something. Do you want to try it?" And of course I did. I lost the weight. And then the pharmacist in me just kind of stepped in and said, "Oh, girl, you could just go in the pharmacy and get a probiotic. They're all the same." And then I didn't get any information or education otherwise. So I then decided to just keep trying to maintain on my own. After the third sinus surgery, and my sister, who you'll hear from later, Dr. Williams, she was like, "You know what? You might want to look at that probiotic again." Because some of the things I see and we talk about all the time may be underlying and inhibiting your journey or your wellness. And so I was like, okay, well, if my sister says, my dentist says that I should look into this again, I will. And you guys, I'm so glad that I did, because even as a healthcare professional, as a pharmacist, I was very limited in my view of what role probiotics played in my health. And I didn't really see a difference when I was. And then when I was recommending them, when people would ask me for my advice about it, I would say, "Oh, well, just go. We have some on sale, or we have coupons this week for this probiotic or that probiotic." I felt like maybe the refrigerated ones that I had to order from the wholesaler, maybe it may have been better, or the ones at Whole Foods, those probably were the best because they were the most expensive. Now that I know that those are not the case, that all of those reasons are not the case at all, they're myths. And I have been able to fascinated with the benefits of plant-based supplementation for a lot of different reasons. And we'll go over it as the night goes on. But what I want to do is have you hear from some of our amazing healthcare professionals on our team that will bring you their perspective of why they Plexus. What is Plexus? Plexus is a company that has developed a very focused, plant-based, high-quality supplement line that focuses on gut health. Why is that important? Because I got on here because I thought I was going to hear about losing weight. I got on here because my friend told me if I want to get my A1C down, then I should get on these products. What does that have to do with gut health? I'm not constipated, I'm regular. I don't have indigestion. I don't have nausea. What does that all have to do with gut health, right? And that is the fascinating thing about what you're going to hear today. It has everything to do with it. 70% of our immune system lives in our gut. 70 to 80% of our mood boosting hormones are modulated from the gut bacteria, and a lot of inflammation is stemmed from not having the right amount of gut bacteria. Oh, well, I'm particular about what I eat. I grow all my vegetables in the backyard. I exercise 5 times a week. I only eat plant-based. I'm vegan. I'm good. Well, that is, yay, kudos. But because of soil quality, stress and anxiety, I don't know anybody who is stressed out during these times, right? Pollution, just toxins that we put on our skin, breathe, walk around, and are inundated with in the society that we live in today, factor into all of that. So as many layers as I can put on what's going on to benefit me, that's what Plexus is helping me do. It's a layer, right? I'm not saying Plexus does not, it's supplement. So of course we don't diagnose, cure, treat any disease, but what we do is help to heal your gut, to help your body heal itself. So without further ado, I'm going to pass the mic over to our resident nurse practitioner, Janine Debon, and I'll let her take the floor. Go ahead, Janine.
I feel like I should have a mic. Good evening. My name is Janine Dabon, and I am a very blessed Senior Gold Ambassador. And what that just means is that I'm really excited to share not only what I know, but also what I've experienced being a part of this journey for the past, since June 30th. So my background is I practiced as a registered nurse for over 15 years and went on to obtain my master's degree as a nurse practitioner. And so I've been practicing for the past 5 years as a nurse practitioner here in New Orleans at Tulane University. And I actually run their employee wellness programs for now 2 clinics, as well as an occupational health clinic. And so this is right in my wheelhouse of what I love to do. And that is to educate and inspire people to really be an advocate for their health. And so just a little bit about how I was introduced. My good girlfriend, Dr. Sylvia Jones, reached out to me from Houston, Texas, and said, oh, I want you to hear about these plant-based supplements. And one of the things that I was big and still am into is culinary medicine. And she's like, culinary medicine, what's that? So I shared with her that we want people not to know just how to cook, but what to cook. And so we talked about that for a while, and she invited me to a call, and I listened, and I said, okay. And then she invited me again, and I started to think about the journey that I had been on myself. So I'll share that in 2015, I was hypertensive, obese, unbeknownst to me. It was a word I think that was kind of new at the time, in my opinion, because the doctors weren't really telling you were obese. And when I left out, I looked at my paper and it said obese, and I was completely offended. I couldn't even believe it. And I was like, what is this? And so he said, well, you need to work on your weight. And I didn't really have any what that meant. I said, okay, I'm a healthcare professional, but how do I help myself? I'm good at telling everybody else what to do. And so time went on, and I felt like I was doing all the things and the weight wasn't coming off. And so I sought help to lose weight, and all that was offered was more medication to help me lose weight, right? And so flash forwarding to now, when Sylvia reached out to me, I started thinking about it. I said, well, you know what? This is really, they have something here, because when I talk to my patients, a lot of times I found in the past, we didn't really have a goal on how to help them get better and what was the internal reason or cause, right? We're kind of like, oh, you have hypertension, here's a pill. Oh, you have anxiety, here's a pill. Oh, you have, and I'm not saying that you don't need those things, so please hear what I'm saying, but what I am saying is we know now that there's a root cause. And I've been intrigued since the day I was introduced to the gut health and all of the research that's out there about just how much gut health impacts your overall health, and not just your physical health, but your mental health as well. And so for me, some of the benefits that I've received along the way, I can tell you that anxiety hit. You don't realize just how anxious you are until you don't sleep at night. You wake up multiple times a night. You wake up in the morning, like then you wake up in the morning being anxious about the day. So you went to bed anxious, you woke up anxious. So you're thinking you can't sleep. And so when I started my plexus, I thought, I've been sleeping. I've been sleeping really good, like deep sleep, not just that little short sleep that you wake up. I actually wake up refreshed. So much so now, without an alarm clock, I'm up at like 5:30. Now I don't get up, but I am up, and I could get up, but I don't. So I have a lot more energy in my life. I also noticed the overall inflammation, and this is key because a lot of conditions are painless inflammation, like high blood pressure, like diabetes, like high cholesterol. And so you have that overall inflammation going on, and you don't even realize it because no one runs to the doctor and says, "Oh, my cholesterol is hurting me." Nobody does that. You know how we find out? When we do your blood work. And a lot of people don't go get that done either. So this, these are things that, and I'm sharing that as little pearls to make sure that everyone knows you got to get in to see your provider. But with that being said, for me, the other unexpected blessing was my daughter, who has suffered with constipation she's 11 now. And as far back as I can remember, she suffered with constipation, hospitalization, NG tube, the whole 9 yards, suppositories, and everything you can think of that deals with constipation, she's taken it. And when she started the supplement, we started together. I said, this is going to be a family event. We started together. And I noticed that every day she was coming home and disappearing to the bathroom. And I said, what are you doing? She's like, oh, I got to go to the bathroom. I was like, 1 or 2. And she's like, 2. And then she one day started dancing and saying, I'm not bloated anymore. I don't feel full all the time. My stomach doesn't hurt. I go without any problem. And so for me, I said, this is, really amazing more than anything. And I thought to myself, here I am, a healthcare professional, and not even realizing just how important the gut component is to mental health and physical health. And so I thank you guys for listening to me tonight, but I'm really super excited and encourage you to listen even closer.
Yes, Janine, thank you so much. Those things that you said, but it doesn't hurt. And that's another thing. I think that we excuse away the things that we can manage, and that, oh, well, it's not that bad. So when I started sharing with my friends, and because I was really trying to get relief, of course, from my chronic sinusitis, and my allergies, and yeast infections as a result of antibiotics. Because I will interject here, 1 round of antibiotics not only wipes out your good bacteria, the infected, the bad stuff, but it wipes out the good stuff too. So it takes a year for your system to get back in balance. I didn't understand that, so when you're over focused, and can you do that with food? Absolutely. If you're eating a probiotic foods like sauerkraut and kimchi, drinking kombucha, to maintain that level, yes. But if there's an imbalance, it takes a concentrated effort to get back to that balance. We should have 80% good bacteria and 20% bad. So there is a role for bad bacteria in our body. It's just that high carb and sugar diets just throw that balance off and keep feeding that bad bacteria. Bad bacteria, candida yeast, fungal overgrowth, that is fueled by sugar. And what fuels our good bacteria, our lactobacillus, bifidobacterium, all the ones that they say that we need for a healthy immune system and healthy processes, that's fueled by prebiotics. I never understood the role of prebiotics. What is a prebiotic? Why do we need it? Well, that's the food for your probiotics. So you're kind of creating, not kind of, you are creating a very good ecosystem in your gut. In your gut microbiome, microbiome is where the bugs live on your body. So your microbiome, we have a large one in our gut. We have a large one on our skin. We have a large one in our lungs, eyes, ears, sinus cavity, oral microbiome. So those are the bacteria that are supposed to be there helping us to thrive, helping us to be well. When that balance is off in the gut, especially, it sends signals a lot of times to all those other microbiomes. So you may see symptoms with in your lungs with asthma, reactive airway disease. You'll see it in your sinuses, like I had the fungal overgrowth in my right sinus cavity. You'll see allergies. You'll see skin infections, eczema, psoriasis, dandruff. Um, I mean, the list goes on and on and on. I wish we can bring that list of symptoms up, Erica. Just maybe after Nikki goes, I'll come back to that. But things that you didn't even I didn't even know, like brain fog, being very tired, chronic fatigue. That is bad bacteria playing into that. A lot of times, when we talk about the symptoms, I'll come back to that. But thank you so much, Janine. I love your testimony. I love that you had that nutritional background, so you understood the nutritional gaps that were happening because your gut was imbalanced. When we have an imbalanced gut, our body is not absorbing the nutrients from the food we are getting, right? And if we have a high carb and high sugar diet, then you're feeding that bad bacteria cycle. So if you look at the screen, thank you so much, Erica. If you look at the screen, the symptoms, if you experience any of these symptoms regularly, it could be a very strong signal that your gut bacteria is imbalanced and the bad bacteria is winning out. I like to look at this because the first column, it kind of makes sense if you look kind of towards the bottom, constipation, diarrhea. If I have a gut problem, a problem in my gut, I might have those symptoms, right? I may have bloating and gas. I may experience IBS or been diagnosed with indigestion, acid reflux. But did you know that gut bacteria and fungal overgrowth specifically can show up as bulimia or anorexia? Cravings for dairy, sour foods, high carb and sugar and alcohol cravings. The bugs or the bad bacteria, if they're overgrown and that balance is really off, then that's what you're craving. So it's not necessarily your sweet tooth. That could be, oh, well, I just have to have this every day, or I just have to drink soda, I just need it, or I just have to have coffee, well, sugar, coffee with my sugar, y'all know what I mean? Like that can be a signal that your bad bacteria is winning. Thyroid dysfunction. If you go to the middle column, night sweats, lack of concentration, mood swings. This is all what I had decided was normal, because when you live a very active lifestyle, you have stress, high anxiety, well, we just manage, right? Headaches and migraines signal that your gut bacteria is imbalanced. You have a lot of inflammation. The last column, chronic fatigue, muscle weakness, irregular heartbeat, cold hands and feet, allergies, acne, eczema and dandruff, frequent infections, asthma, persistent cough, ear pain, and the list goes on and on. Fungal infections, painful. I think you guys get the idea. So when I realized this and the light bulb went off for me, that a lot of times when we're trying to address a medical situation that comes like a disease state, like a diagnosis, and we don't correct this baseline issue or don't know about it enough to correct it, then you're kind of fighting an uphill battle. When you do understand that the balance in your gut can decrease your overall inflammation, and the right amount of products, which we'll talk later, can help level the playing field, set you up for success, so that your interventions that the doctor may be prescribing you, the way you're managing your disease state and your health can respond more appropriately and act and improve your quality of life. So with that, thank you so much, Erica, for finding that for me. I think that is a good visual to kind of tie into why we can't stop talking about getting your gut together. We have one of our other resident teammates, Nikki Swain. She is a registered nurse. I'm so excited to hear from Nikki today. Thank you again for sharing. And I'll go ahead and let you take it away.
Hi, everyone. Again, my name is Nikki Swain, and I'm a registered nurse. I've been a nurse now in about 16 years in various roles. I'm master's prepared, but this role I am at United Healthcare with Optum, working with Walmart members trying to best utilize their benefits. So more of like a case management role, healthcare professional role. But very, very informative. I've learned a lot there. I have been with Plexus now about a month and a half. I am now a senior silver ambassador. So I started using my products in October consistently, appropriately, not skipping a day here and there. And about 2 weeks into using my products, I began to just kind of feel normal again. I experienced a tragic death in our family back in May, and I was just searching for something to kind of help me feel normal. I was on different meds that made me feel sluggish and tired. I would take them at night, but not feel like myself until 3 or 4 in the afternoon. My blood pressure was fluctuating. It was high, it was low, it was just kind of all over the place. One of my friends had a post on Facebook, which was Janine. We actually went to high school together, so I'm dating myself with that. And I tried it. I'm like, I don't have anything to lose. It's plant-based. It's everything that I tell my members that they should be doing. I work out. I'm all about self-care, but I just didn't feel right. The products have been amazing for me. I am now sleeping through the night. That was the first thing that I noticed. My blood pressure has stabilized. I'm still taking my medication, but it is so much better to the point where we're considering coming off in about 3 months. My abdominal issues, I felt like I always had an upset stomach, like something's wrong. I just feel nauseous. That has now subsided, and I've dropped probably another 10 pounds, which was unexpected, but pleasant surprise, I'll take it. It has been a great start to my journey. I'll look forward to bringing on as many people as possible, because the more we know, the more we share, the more other people can feel well also. And that's the biggest and greatest benefit that I've noticed, just being on the calls, interacting with other team members. You begin to feel better almost instantly. So thank you so much for allowing me some time this evening, and I'm excited to be here. So thank you.
Nikki, that's so amazing. There are a couple of things that I want to call out. I didn't know we worked together, girl. Okay.
Yes.
So we work together. So we'll have to get together on that later. But when you talked about how you feel, we're looking for something to feel better after the tragedy, and the meds were just kind of making you not feel yourself.
Right.
I think that has been the most fascinating thing about this journey for me, because people are looking for relief from stress and anxiety, especially during these times. And we oftentimes are guided to medication or prescriptive interventions for that. Now that I know that good gut bacteria or probiotics, the right amount, help to substantiate making serotonin, that's going to sound familiar here, helping your body to just be balanced and absorbing the minerals and vitamins to help you be vibrant, decreasing that brain fog and just that overall overwhelm of tired. again, here we are talking about a gut-brain axis where your body, your gut is telling your brain something, how to react, and your brain is telling your gut. It's a symbiotic relationship. And when your gut is in balance, guess what? Your reactions are in balance. Here we are again talking about something that we didn't know. What does that have to do with gut health? Okay, we're going to keep talking about it. We're going to keep drilling it in. It has everything to do with gut health. And there are some team members on this call even who have gotten with their doctor, worked with their doctor to get off of their anxiety medications, off of their depression medications, because if you're consistent on your gut health and making sure you have the right bugs in your gut, then it opens up a whole lot of unexpected blessings. And I love Dr. Williams' testimony because she talks a lot about unexpected blessings. Dr. Williams is somebody who didn't need to lose weight, right? And it was like, well, what? You don't need Plexus. You don't need to lose weight because it's so much more than weight loss. So Dr. Williams, thank you for joining us. And I'm going to go ahead and hand it over to you.
Thank you, dear sister. Yes, hello, everyone. My name is Dr. Adrienne Williams, and I am a dentist here in Houston. And a few years back, I started my own practice. What I found and what I was looking to do was to really impact a larger part of my community that I had. Been practicing for about 10 years in a public health area. We dealt a lot with patients with diabetes, with high blood pressure, just medically compromised patients. And I knew the connection between the mouth and the rest of the body. We talked about it. We talked about it with our patients all the time, and how they needed to eat right, and they needed to take care of their teeth because that would impact their diabetic state, and that would impact their high blood pressure. And they, one would not heal, or they would continue to be in a disease state if the mouth, was still unhealthy. So we really hit that home. We really that was a passion of mine, and prevention especially has always been that for me. I struck out to open my own practice just to impact a greater part of the community. And what I found was I was seeing a lot of the same disease processes. So we always thought it was a lack of money and resources, but I was seeing the same or more, diabetics and patients with high blood pressure and uncontrolled even. So I knew I needed to do something. And I stepped in. I started talking to my colleagues, doing research to see what that connection was. I knew the connection was there, and I was just trying to really figure out a way to really help the patients. And as I was treating them and doing all the right treatments and the medications, some just weren't getting better, and they had the perfect home care. They were doing all the right things. However, something just wasn't, we weren't getting the good, healthy gums and teeth that I really thought we should. Until a specialist, a periodontal gum specialist, spoke to me while I was talking to her about it, and a friend that she said, well, that the periodontal disease, which is gum disease, is controlled by the immune system, and that's mediated by stress. A light bulb went off, because I had been dealing with inflammation all over my body. Every doctor I went to, I was seeing the specialist for this, for skin, and for allergies, and had been my whole life, really. But new doctors were having to come on board because I was starting to feel worse, and did not really understand that gut connection. I was doing all these things to try to manage disease states all over my body. And doing all the right things. And so that's why I saw that in my patients. We were doing all the right things. I was not talking to them about gut health though. And so that hit me like a ton of bricks, that my health was reflected back to me. Yes, Dr. Sharon Warren, reflected back to me in my patients. And that's when I knew, oh, I have to tell everybody about how important gut health is. Because by that time I was on my journey, and I was getting the connection I was feeling better, it didn't occur to me how impactful it would be for my patients who were really, because I needed to use the restroom. I knew I wasn't having the same vaginal infections like or recurrences that I would have been having, but I was using antibiotics and sinuses. I was using antibiotics and those in ibuprofen and things to treat my symptoms, whereas I needed to get to the root cause of the disease. So now I really stress the importance of managing your diet, the exercise, your stress, because stress is a bulldozer to your good microbes, and your good microbes are controlling, they're facilitating all your systems and your bodily processes. So they're making an impact there. So that's why they say, stress kills. It really does. It does not allow your body to heal and function as it should. So I tell them about managing stress in addition to doing the treatments, because if the disease is still in their mouth, if that rotten tooth is still there, or that gum disease is still there, they will never heal. But their gut has to, their body has to clear it. Their gut has to be healthy. Their immune responses have to be so much more succinct to handle like the threats. It needs to be able to, and not just be fighting against itself, because that's what ends up happening when our guts are leaking out and our body starts fighting itself. So with that, I found a relief in my inflammation, my body, my life. Everything changed with that. And I'm trying to get that out to, like I said, my community. I want to make an impact on my community. So I need to, all those years of antibiotics and things that I was giving all the patients, I'm starting to pull back from that. And we're having a different conversation. They're on probiotics. When I give them a prescription, we're addressing the root cause, and I'm giving them the information about, the gut microbiome. So that's my story. I don't want to hold you too long, or part of my story. I don't want to hold you guys too long, but it makes such an impact. How the body can heal is definitely through the gut. And I know that I knew the mouth was like a gateway for like patients to have heart, was connected to heart disease, heart attacks, cardiovascular disease, Alzheimer's disease. And that's why I was so passionate about, getting rid of their dental problems, however, it was at the end of the day, it's inflammation. So we have to take care of inflammation everywhere. It's so, so important. So thank you for your attention. I'm going to pass it back to you, Rachel, because you are going to go over products and
Yes.
talk about some of our faves.
Yeah. Yes, thank you. It is a continuous line from your mouth to your gut and all the way through, right? So it makes sense when my doctor told me, hey, I know we're doing all the right things, right? And I know that, we're still not where we need to be. I'm still seeing this, I'm still seeing that. And now I'm excited to go back to see Dr. Williams and her staff, because I'm like, oh, I've been on my regimen, I'm good, I've been taking my stuff, and I'm excited to see what are some of the things that are going to be my wins in that area. It is all interrelated, y'all. Leaky gut syndrome is a real thing. Okay. Our gut is, the lining of our gut is supposed to be tight, right? And I like how Rhea does it. She has perfect little hands. But as time goes on, for all those things that I mentioned earlier, like high carb, high sugar diets, chronic inflammation, pollution, being toxic, not having an alkaline environment, all those things. So it starts to open up, and things start to get out of your gut that aren't supposed to. So what does the body do? Because the immune system's primary thing, your body is designed to protect itself. So what is it going to do? It's going to attack those things that are foreign to it, those things that are leaking out of the gut that aren't supposed to. So what happens? Your inflammation goes up. And then what happens when you get a trauma, like a knee injury or some kind of infection? Well, then that inflammation has to go into overdrive, and we start seeing autoimmune diseases. We start seeing just an exacerbation of chronic inflammation, chronic inflammation like IBS, Crohn's. Well, I know that Plexus can't help me because I have liver problems, or I have a kidney problem. Well, chronic inflammation is chronic inflammation, and your gut bacteria is there to, the good gut bacteria is there to help you. So when you're calming that part down and you have that under control, guess how much more successful your body is going to be in the healing process on its own, right? So if you think about it in those terms, it makes sense that we are getting rid of that chronic inflammation. How are you doing that? Well, the first product that the company designed was for diabetics, type 2 diabetics and pre-diabetics, to keep their blood sugars in a healthy range, because we know sugar is killing us, y'all. And the more balance we can have our blood sugars throughout the day, the better. So the Slim, don't let the name fool you, and I'll tell you why. Slim is the pink drink that you've been seeing all the rave about on social media, and all your friends and anybody on here that you know drinks pink drink, right? Because it is pink in color because of the beetroot extract. What is that? Well, that beets are highly anti-inflammatory and natural source, right? So they extracted it out and put it into a form that is very doable every day. So it has beetroot extract, it has chromium to keep your blood sugars in a healthy range, glucose metabolism. It helps to maximize glucose metabolism. Well, is it going to send me into low blood sugar episodes? No, because chromium is only going to use the glucose that you have, and is helping your cells to better metabolize it. And if you can do that on a consistent basis, you're setting yourself up to stop feeding the bad bacteria. Your sugar cravings go down, your carb cravings go down, and then you're not feeding the bad bacteria. So you see how that goes? So consistently using it is setting yourself up to get rid of those sugar addictions. Slim also has ALA. ALA is alpha lipoic acid. Is good for antioxidant. Is good for cell integrity. It gets into the cell level and takes the inflammation out. A lot of people that are consistent on Slim are seeing their cholesterol numbers get balanced. Good cholesterol goes up, bad cholesterol goes down, and we all love to see those numbers get in range. Also see a decrease or balancing out of the blood pressure. You heard Nikki talk about that. You heard Janine talk about it a little bit. It is the combination of the products, but the anti-inflammatory in Slim does help to keep your blood sugar balanced. Blood pressure balanced. The sweetener in the Slim is stevia. And so it's, then again, of course, a natural sweetener that what I use Splenda. So I'm doing better because I'm controlling my calories, and that's helping my diet. So I'm doing good. Well, I didn't know, little did we know, that the artificial sweeteners kill your good gut bacteria. So what are you doing when, you don't have as many calories as regular sugar, but your good bacteria is dying off even more. So that's why our products are sweetened with stevia, because it's a natural sweetener that does not kill your good gut bacteria. So yay on that. There are no artificial sweeteners, artificial colors in any of our products. Everything is all natural, plant-based. And so the flavors in here come from extracts from actual fruit. It does have some prebiotics. So remember I told you that prebiotics are the food for probiotics, and that's how you keep your probiotics growing and thriving. The Slim, we have two forms. One, the hunger control. If you need weight loss support, if it's a goal for you, I would go with Hunger Control Slim. It has a bulk forming prebiotic fiber, meaning that it's going to help you feel full so you can make better food choices and have portion control. I like it because I prefer the taste of it, but it does actually, when you take it 20 to 30 minutes before meals, really help you to think about your food choices. When you are keeping your blood sugars in a healthy range, getting your gut bacteria in line, you start craving different things because your pH is different, your taste buds are different. That bad bacteria is not craving the sugar, and then the products are helping you to support that. So the other version of the Slim is microbiome activating, and that one has a different prebiotic fiber, so it's not bulk forming. So if weight loss is not a health goal for you and you don't need support in that area, I would go with the microbiome activating Slim. So that is the Slim. The second product in the triplex, I'm going over the triplex. Plexus has a product combo called triplex that are the gut health staples. So the first product is the Slim, and you put this in water, you drink it daily, or you drink it twice a day if you need extra weight loss support. The second product is our ProBio 5. Why won't I just go to CVS, Walgreens, or my boutique pharmacy to get their probiotic? Well, I'm glad you asked. The reason why this is a stellar product and this is superior is because of the technology that is used to get it to your gut. We were talking to a lady, we went to the detox spa today, and we were talking to the owner there, and she goes, well, you know, your stomach is very acidic, and, you know, you have to make sure that those probiotics get into your gut. And I'm just curious because I drink mine. And I said, well, we have a freeze dry technology, right? So it can weather the storm of your stomach acid environment and get to your gut. And that's why this is superior. It has 5 strains of probiotics that are essential in your daily, your bodily functions. And it also has one that has an antifungal component, Saccharomyces. Saccharomyces helps to break down the candida, which is very fierce. And then this also has digestive enzymes. So it helps to break down the outer shell of the bad bacteria and break it down. And then the probiotics are getting in there and seeding themselves into your gut. The third product, that brings on the third product. The third product in the triplex is BioCleanse. BioCleanse, okay, so erase any negative image that you have when I said cleanse, because I saw y'all went, oh, I don't want that. Cleanse. It's a laxative. That means that I'm not going to be able to do anything. I'm not going to be able to live my life. I'm going to be married to the toilet. No, this is not a laxative. It is a very high quality magnesium product. Magnesium deficiency is linked to a lot of different processes: irregular heartbeat, muscle cramps, imbalanced blood pressure or elevated blood pressure, migraine headaches, and constipation or irregularity. So magnesium is so important. And when you add this to the digestive enzymes and the antifungal in the probiotic, you're helping your body to naturally detoxify. This also has vitamin C and bioflavonoids, which are very important in oxygenating your environment. If you know anything about cells that like to be radical, like and thrive in acidic environments, by adding BioCleanse to your regimen, you are making the environment less likely for you to be able to grow cells that reproduce rapidly. So that is the best way with these 2 products, especially, to adjust your pH and have a good thriving environment so that cancer cells, radical cells, those things do not thrive. So that's why these are good by themselves, but they're exponentially better together for all those reasons why I just named. Plexus does realize that once you balance out your gut and get rid of that overall inflammation, you'll look like you lost more weight than you actually did. That's why we like to tell people when they're getting started on their journey to do if weight loss is the goal, do your measurements, because you'll see the inches fall off first, and then the pounds. After consistent use, the pounds will go, because your body is balancing itself. You if you need to gain weight, you'll gain weight, healthy weight. If you need to lose weight, then you'll lose the weight. But it takes time. And the company does recognize that sometimes people don't want to wait. We want to lose 30 pounds in 30 days. Well, that's really not the goal here. The goal is to heal yourself first. That's the body's primary function. We have a very awesome Rockstar team member, Heather, that posted today on her social media that, man, you know, I'm focused on wellness and that was my goal. But, and like Nikki said, she's like, oh, well, losing those 10 pounds didn't hurt either, right? Because it was a welcomed, unexpected blessing for her. But the company does have very stellar, before I move on to the weight loss products, I am going to talk about the anti-inflammatory, natural anti-inflammatory Ease. It has turmeric. It is derived from green lip New Zealand mussel. Very plant. It's all plant. Well, not plant based because the mussel is derived from a shell of a mussel. So if you have a seafood or shellfish allergy, there are a lot of people who can still take this, but we just like to put that out there that this product actually is not all plant based. It does have the derivative of the shell of a oyster mussel, but it is phenomenal in relieving some discomfort and overall inflammation. I did have lower back pain, but I was like, oh well, because it was normal to me, right? I had decided that I was just gonna push through. I added ease to my regimen, and y'all, I didn't have to see my chiropractor. I mean, she was like, hey, where are you? Because you still
I want some chips up, baby.
I'm like, okay, well, I wasn't having the back pain anymore. So, but this really does help to just take it. And then we found out through research that if you're starting on your detox journey with Triplex, because sometimes it's uncomfortable because you're getting rid of that bad stuff, you have to push it out, that ease, adding ease. So anybody that's already on Triplex, add ease to help to push through some of those detox uncomfortable symptoms. X Factor Plus is our multivitamin. It is jam-packed with all the vitamins and minerals that you need. Also has aloe, which is an antioxidant. So people are experiencing a lot of wins in premenopause, menopausal symptoms, relief from night sweats. I'm adding this to my kids for their vibrancy, just their mental clarity on their regimen. And very excited about hair growth, nail growth. I get texts all the time like, I don't know what this thing is doing, but my hair and my nails are phenomenal. So, and it has to do with getting your gut in balance first, but this definitely takes it up a notch. That's the X Factor Plus multivitamin. So let me talk about the weight loss products. One of my favorite is the MetaBurn, which is a natural, it helps to lift your metabolism naturally. It has B vitamins, nothing that makes you jittery. And that's what I love about it, because I've taken those over the counter things before, like Metabolife. Y'all remember that? And I was like, I'm like, what's wrong with you? Now I take MetaBurn and it just gives me a natural lift, and it helps to burn the fat from my thighs and my midsection. And it's noticeable when you're doing the measurements on your inches. You're like, okay, I see. So you can take that twice a day. And it's a phenomenal product. We do have a lean, which is our protein, plant-based protein. We have it in whey and vegan. And that if weight loss is the goal for you, or if not, if you just want a healthy meal replacement to increase your protein, then you would replace one meal or 2 meals a day, depending on what your goals are. It is very tasty. I have choked down chalky protein because I'm a runner. And I know the benefits of it, but with lean, I don't have to do that. So I know other people can vouch in the chat about how we have the chocolate and the vanilla, and it is phenomenal. Balance is our carb blocker. So what Balance does is you take it 20 to 30 minutes before your heaviest carb meal, and it helps to delay the absorption of the carbs, therefore keeping your blood sugars in a healthy range. Remember, I talked about that earlier. Keeping your blood sugars in a healthy range is the goal overall. If you could do it with food, great. If you need some support like me, and you can take a Balance, if you decide, oh, I'm going to have a glass of wine, or your heaviest carb meal, if you're going to eat the chips, just go ahead and do that. That has been a game changer for me, and I really love, because it also has 5-HTP, which is mood boosting, so it makes you feel good. That brings me to Vital Biome. If anybody can show their Vital Biome. Vital Biome are probiotics that are specific to your mood producing hormones. So they are added to ProBio 5. You take a Vital Biome in the mornings and you take ProBio 5 at night, but Vital Biome adds that. It's a sister product to the ProBio 5, and it just gives you that extra you need for stress and anxiety and those bugs. Thank you, Janine. And those bugs that help in those processes. It's a real thing, y'all. I didn't think I needed it, Vital Biome, but when I added it, boy, did I notice the difference. You just have a better outlook. To me, I feel less overwhelmed if that makes sense to you. With that, I'm going to entertain any questions. You guys can either unmute yourself or put your questions in the chat. Will you talk about edge? Yes, I've been hearing, you know what? I have been hearing rave reviews about edge. I had one of my friends call me the other day and she's like, yes, well, I took edge and I'm going to recommend it for everybody. Edge is a product that is for focus. Now it does have a little bit of caffeine, a little bit more than a cup of coffee, but it is a naturally derived source of caffeine. So it should help calm down on the jitters that you might feel if you're sensitive to caffeine. But boy, I think it has B vitamins as well, all plant-based, and it is a nice a nice addition to when you're not feeling as focused and for mental clarity. So I'm excited. I haven't tried. That's one product that I haven't tried. So I'm excited. I'm going to add that to my regimen, and I'll have to get back and let y'all know. But I've been hearing rave reviews about that. X Factor Kids. Thank you, Janine, for reminding me. As much as our guts are imbalanced, it's not just because we woke up like this. We started like this as kids, right? And our kids are experiencing the same thing. So you think the brain fog, the inability to sit still, lack of focus, constipation, not getting enough nutrients, all affects them as well. So we have a stellar product. It's a chewable vitamin sweetened with xylitol. Xylitol has been proven to help prevent cavities, unlike the gummies that they like to take, right? So by switching to X Factor Kids, you're not only getting a vitamin that is a multivitamin that's sweetened with xylitol that'll help prevent cavities, you are also getting probiotics in their system as well. So you'll see them be more regular. You see their energy go up, their focus get better. Even moms with autistic kids have testimonies on more words and just ability to manage some symptoms that they were, helping their kids with. Just wins on top of wins on top of wins. So we also have added this year a drink for the kids. It's called Mega Kids Microbiome. And so you put it in water. Yes. Just kind of like, remember Tang, y'all? You just kind of scoop it out and put it in there. It is also sweetened with stevia, so it doesn't add to their sugar. And it just helps them to also have less sugar cravings. It has DHA, which is good for brain function. It has lutein, which is good for eye development. Everything that they should have gotten or were getting when you were nursing them, they can get it in these two products. So it is a game changer with their nutritional support. So if you have kiddos, I encourage you strongly to go ahead and get them switched over to those two products. And it tastes good. The drink is well, one of my girls likes it, one doesn't, but there you go with that. But it's a tropical punch flavor and most kids like it. So with that, do we have any questions in the chat? Let's see. Testimony.
Rachel, there's a question in the chat about the BioCleanse and the amount of magnesium.
Okay, it is I think 80 milligrams. I looked it up. Was that product? So it is, you can take up to 4 a day, and then sometimes when you're pushing through detox, of course, you want to, magnesium is not that soluble, so whatever your body does not use, it should be excreted. And so the risk of toxicity is low. But you do definitely, whenever you're starting on a new regimen, you do want to make sure that you're contacting your provider if you have, or consulting your provider if you have any concerns about that. But the formulation, it is bioavailable, but it should be excreted all of the magnesium that your body is not using. And a lot of times that I've been doing a lot of research on magnesium deficiency, and a lot of times people will experience the GI side effects. And so they go, oh, well, I can't take magnesium. But initially when you're getting your gut balance, some of that elimination is good just to push through the detox, and the person who invited you will coach you through that. If it lasts more than a couple of days, of course, you want to make sure that you are staying properly hydrated and then maybe adjusting the amount of capsules that you use. Just a question. While taking or trying to get pregnant? Yes. Oh, I'm so glad you asked that. There's so many fertility wins when we get our guts in balance. You definitely want to. I have several. Okay, so the answer to that, the short answer to that is yes, absolutely. There's so many wins of pregnant women and people trying to get pregnant who incorporate this gut health, because the products are plant-based. The products are very equivalent to, so I had a pregnant customer who was asking me about what regimen she should try. She was in her second trimester and she couldn't find a multivitamin that she could stomach. A lot of times it's because of bad bacteria. Somebody's sharing a screen. A bad bacteria is blocking the absorption, or just you having a lot of different processes with your hormones, right? So triplex is good, is safe for pregnancy. I would do the microbiome activating slim, and then the X Factor Plus and Mega X. Mega X is our plant-based omega supplement. So instead of taking a prenatal with DHA, you would take X Factor or X Factor Plus with Mega X. But of course, you would talk to your OB about that. But yes, the pregnancies that we see are flourishing because their overall inflammation is decreased, so they're not getting that swelling towards the third trimester. They're having energy because it's not sucked and zapped with an imbalanced gut, and they're adding the things that the baby needs, because a lot of times when we see babies that may have been born C-section, they might not have been inoculated with the moms, or they might not be getting breastfed, so they're not getting those bugs, and all of that transfer is helping the baby. And so I think in our society, a lot of things are factoring into that. You know, we're not dirty enough. We don't play out in the dirt. We're not getting those bugs there. So then we grow up and we're too clean, and then, you know, we're not getting the right bacteria mix. So a lot of things. So thank you. Yes. Pregnancy. Yes. Fertility. Yes. Because when we see your system detox, especially naturally, you incorporate more plants and vegetables, then your endocrine system thrives. Right? So that we've seen a lot of fertility wins with people on Plexus. Any other questions? If you have not already been added to Journey to Health and Happiness, the person who invited you will add you to the group. How do you get started? We have a very awesome opportunity, and the person who invited you will walk you through the different combination of products. I know we threw a lot at you tonight, but there is a sale on the welcome packs. When you enroll as a wholesale customer, you unlock the best price. We do also have a 10% off, so they will give you the code for that, and they will walk you through how to order your products. We ask that you dedicate 2 to 3 months to being consistent on the products. Well, why? I should know if it works in 2 weeks. Well, it takes a while to reset and undo a lot of the things that we've done to ourselves unbeknownst to us, right? So when you're going out and planting a garden, you don't go and plant the seed one day and then come back next week and expect a whole, plant with the flower, right? And that's the same thing. And that's a mindset that I tell people to go into it with. You didn't get this way or imbalanced in 2 weeks. So it's not going to be resolved. And if you've heard Nikki and you heard Janine, you heard Dr. Williams, and I will tell you as well, I wasn't as consistent. And I'm like, oh, well, maybe I'll go and do something else because this just isn't working for me. But when I was encouraged to be consistent, drink my water, stay well hydrated, and take my products, and now I'm like, oh, wow. Now I have to tell everybody because I'm getting off of my nasal sprays. So I'm saving lots of money going to the doctor. no nasal sprays, and you know those aren't cheap, missing work or whatever you had to do to go to the appointments, all of that adds up, and my quality of life has been improved, and I've been able to help a lot of people. When one of my friends was DC'd off of her insulin therapy, y'all, I was like, okay, well, this is it. I just, and my husband, of course, he wants to say, well, I don't know. I just got off one of my blood pressure medications, but I'm still going to see. I was like, okay, you're going to see, but you can still take this, because this was the reason why you are being, and the stories just come rolling in. It's not just one or two here or there. It's just what happens when we stop. So say like you have, like Rhea likes to say, and I'm gonna leave you guys with this. You have a rock in your shoe, right? So then you go to the medicine cabinet, you take the ibuprofen or the Tylenol, and then the pain is a little bit subsided. But why don't we just stop, take the shoe off, take the rock out, then the pain goes away, and we've addressed the root cause, right? That's what this system is doing when you really are uber focused on having the right amount of products to help you unlock your body's natural ability to heal itself. So thank you, guys. I know we can talk forever and ever and ever about gut health and about Plexus, but I'll leave you with that. Get with the person who invited you. If you did not already, if your name is not on the screen, if you did not, tell us who you are so that we can direct you or let your person who invited you know you were on. Please do that. And we, like all of us, and I'll speak on behalf of the whole team, thank you so much for listening in. Thank you for those who invited people, for caring enough to share the information. And we hope you guys have an awesome night.
Rachel.
Yes.
I wanted to add something on the shoe because you asked a question. And if you guys have a question, and you can unmute yourself, because you have Janine, Adrienne, Nikki, Rachel, they're just a fantastic resource. But I'm not a scientist, but you said, why don't you just stop and take the rock out of your shoe? And I think if we all just absorb that question for a minute, think about it. I don't have time. I'm gonna do it. Oh, I can't stop right now. I can't stop and get that rock out.
That's good.
That preemptive slowdown, you know how people say sometimes you have to slow down to speed up? That's what we're offering you guys tonight. An opportunity to slow down so that you can speed up, so that you can do more, so that you can feel better, so that your immune system can be have more support, so that your anxiety, we're under chronic stress, y'all. So yeah, now is the time to stop. But I have on shoes that tie. Stop. Maybe you have to find some place to sit down. Maybe you have to pull your foot up. Maybe you have to untie your shoe. Oh, God forbid. Maybe you have to take off your sock. But whatever those steps are, because they're so different for all of us, some of us may have on a high heel slide. That may just make it easier. Whatever the steps are, take that moment, y'all, and get that rock out your shoe.
That's good, friend. That's good. Thank you. Yes, make the time. And this is us giving you a very viable regimen to make the time for you. So thank you, guys. Thank you, Erica. That was awesome. Y'all have a good night. Thank you, Janine and Nikki, for sharing. Dr. Williams. If you guys don't have another question or want to hang back, we'll be here for probably about another 3 or 5 minutes before we hop off. I don't see any other.
I did see a question about, can you drink the Slim after a full meal?
Yes.
I think that's on there.
Mm-hmm. You can. The premise or the reason why they direct you, if you're using it for weight loss, to do it before is just because you'll feel fuller. So it's like a tactical thing, logistics, basically. But I drink mine whenever I can remember. I drink it first thing in the morning, and I don't eat, or I drink it before I run. It just depends on your regimen, and then what works in your lifestyle. And it sometimes takes a minute to figure that out. I've changed my regimen so many times. I finally got a pill box, so I'm gonna try to remember to use it. But yeah, it's different for everybody. What works for one person may not work for the next, and you just kind of have to figure that out and just be open-minded about going on the journey, because it may be some trial and error. We had a couple of iPhones. Kawana, you're quiet. Kawana's quiet.
She's at a game tonight, so she
Oh,
can't really chime in.
My boy played basketball today. I got on and it was like, ah, I said, woo. Yeah, but my boy played basketball at Live Oak tonight, but I still wanted to tune in to the meeting. So yeah, I wanted to figure out how to share like Sharman them shared. I didn't know. I wanted to share, but I'll figure it out next time. But yeah, I listened in. They have another Zoom tonight, right? With the calendar, something with Robin.
We're inviting everybody to jump up and jump over there for the planner party. That's gonna be fun. But I'm hanging back just if anybody has any. Miss Yolanda, thank you so much.
Thank y'all.
Nikki, we're gonna have to get connected, girl, on the chat.
Absolutely. Okay.
On Microsoft Teams. Now that I know, I'm gonna look at it tomorrow.
Okay.
Thank you, Bridget, our illustrious team member. I saw Dr. Sylvia on here. I think she jumped off. Our fearless leader, Rhea. We would not be here without you. So thank you so much for all of your support.
Thanks, Boo.
Sherman,
Great job, Rachel. Great job.
You're welcome. Thank you. Thank you.
Thank you, ladies.
Yeah, Dr. Tiffany Wilson. I think she jumped out, but I wanted to shout her out. Davitra, is that my Davitra? Is that my Davitra? Is that my Santa? Oh my God.
Yes, it is.
Davitra's been on this journey with us in the background, y'all. I'm so excited to see you on the call. Thank you. Thank you for joining. I appreciate the support. All right, y'all. Well, if there are not any other questions, I'm going to allow the people who invited to jump off and follow up with their attendees. And then also to jump off on the planner party. I think that's going to be a lot of fun and very informative. If you have any questions that you did not ask, get with your sponsor. And then if they can't or need support in finding the answer, of course, we're all here to support that. So again, thank you guys so much for joining, and you guys have a good night.